I'm Lisa Tarr, pediatric physical therapist and CEO and founder of First Steps Pediatric Therapy and First Steps Clinic, and we provide occupational and physical therapy in the clinic, in-home, as well as virtually. And oral motor feeding challenges occur when kids actually struggle to coordinate the muscles in their mouth, their lips, their tongue, and jaw. And then these issues actually kind of present some basic difficulties that actually impact your child's ability to chew, move foods in their mouth, and swallow safely. And so this is commonly seen when you're starting from pureed foods and you're going to a solid. So it's really not just about a kid being a picky eater. It's really about a developmental challenge that may require some support and assistance. So some signs that your kids actually might have some oral motor feeding challenges is you're seeing those kids that are gagging and choking or coughing while they're eating. Food falls out of their mouth. It's like being pocketed or it's lingering in their cheeks. You have difficulty with progressing past those purees to like the stage 2 or 3 baby foods. Your kids actually refuse anything that requires some type of chewing. So transitioning to meats actually become a little bit difficult or harder textures. And then they have very long meal times. So it might seem exhausting after eating. So you're like, this was supposed to be fun and we're having a meal. And then you feel exhausted as a parent. A lot of times you're going to see these kids that have excessive drooling. So with the exception of teething, kids past 18 months, they're having like extra pulling or drooling is a sign or indication that they're having some oral motor delays. And then kids that avoid mixed texture, so yogurt with chunks in it or anything like that, they're not having that. So some tips that you guys can try if you think your kids actually have some oral motor feeding challenges at home. Definitely you can use some small soft foods like steamed vegetables, bananas, things with chunks that you can actually match with their gums when really early. You can try some like chilled teethers, different textured spoons, kind of to wake up some of those oral motor muscles. You can definitely work on some singing and playing, smiling during this mealtime, keeping it consistent, letting your child feed themselves. Even when it's messy, I know it's like always horrible, and then letting them feed you. So trying the bites and doing some turn taking is really helpful because you're feeding them. Tips for you guys, new parents, is don't compare your child to others. Milestones do vary quite a bit, so it's okay that your kids aren't on the same timeline. However, if you're feeling like your child is significantly behind or you're having difficulty with things that your friends are not having or other peers are having, then that's definitely time where we can help you. Some other things you guys can try is just taking some video clips. So if you want to track their progress, and then if you actually are in therapy, you can use that to track successful eating activities. Sometimes kids actually like to watch their own videos, depending on the age of your child. So you really just want to trust your gut. So anytime that you're having some feeding difficulties during any meal times, and it becomes really stressful for your child, that's the right time to ask for help. So you want to avoid pressure to eat, and you want to create that as a positive environment, and you don't want to put a lot of pressure on your child to actually complete or finish, whatever food is presented in front of them. And then the other one is you can get messy with them and then playing with the food, even if they're not eating it and getting all over their hands and face, and they're tasting and touching and smelling it is really great. So when do you actually contact a pediatric occupational therapist for help with feeding? So if feeding really becomes a daily struggle, your child's avoiding foods, meal times really difficult, it's affecting your family, you can always reach out for support. So pediatric occupational therapists really help develop the oral motor skills, as well as they create a plan, and then they're gonna help you, coach you through that sensory process just to help. So really the number one thing is early support is going to make a huge difference in your guys' life. And we're going to help you support your child to help them eat confidently and really get to enjoy some meal times again. And you can contact us to schedule a evaluation at 720-989-0179. You can also text us with your name and information, or you can check us out at firststepspediatrictherapy.com. And we provide free 15-minute consults with a licensed therapist to address any of your guys' needs if you have any questions prior to scheduling.